welcome to our Monday Minute. Today we're going to review the 2026 Home Health Proposed Rule that was released on June 30th. This 2026 Home Health Proposed Rule has brought with it many shocking changes. Most of you, I'm sure, are not shocked that there was a proposed amount to cut our base rates, as there has been since the PDGM model began. In the last 3 years, they have proposed a cut, and by the time we got to the final rule, they have cut that adjustment in half. As they have been making these calculations and cutting those adjustments in half, they have been putting what they didn't take back in those years into a clawback fund that we are supposedly going to have to pay back eventually. As a result of that clawback deficit, which is now $5 billion, CMS is this year proposing, in addition to the permanent adjustment, a 5% reduction temporarily, which means for the year 2026 would have to go through rulemaking yet again if they were going to apply it in future years. Those two adjustments, in combination with the increase in the market basket, would basically leave us at a net negative 6.4% to our rates in 2026. Most home health agencies are desperately struggling to survive at this point, and another 6.5% reduction in rates is not going to help that situation. Having said that, CMS is hearing, obviously, at the state level and the national level, that this is a problem. They need to hear from you, individual home health agencies, boots on the ground, how this is directly impacting patient care in your organization. You really need to be a participant, active participant in the advocacy against these rate cuts. As the rule hits the Federal Register officially, there will be links where you can go onto your computer, click a button, and be able to comment on the proposed rule in moments. It's no longer a situation where you're having to create a letter and mail it in, et cetera, et cetera. So please be an active participant in the advocacy against these adjustments. You can also see your state association and the National Alliance for Care at Home in order to get additional tools or comments about exactly what you should be commenting on in this proposed rule. In addition to the rate changes, they have done the typical proposed changes in the review of the case mix weights, the LUPA thresholds, the outlier fixed dollar loss calculation, which is technically a part of the rate calculation. They have also made some other changes that were shocking. One that is a good shock, which was the changes they're proposing to the face-to-face encounter. As of today, a face-to-face encounter must be conducted by the certifying practitioner of the home health care plan or a provider working directly with that certifying provider. Or you can have a face-to-face encounter from a facility in which that patient was directly referred to home health. The proposal is that starting January 1st of 2026, you would be allowed to accept a face-to-face encounter from any acceptable practitioner. For example, if you were accepting a referral from a patient's personal care physician and they were going to sign your home health care plan and you had a face-to-face encounter note from a visit with their cardiologist a week ago, you would be able to use that face-to-face encounter from the cardiologist as your valid face-to-face encounter. This is a huge change, a positive change, and we are very excited about the possibility of it being finalized. In addition, they have made changes that we had hoped would occur, and that is a significant revamping of the HHCAHPS Survey. The HHCAHPS Survey, which goes to patients and or caregivers to ask questions about the quality of care that they received from your home health agency, is being significantly revamped if this proposal is finalized. For example, currently there are 6 questions on this questionnaire about medications. That will be reduced to 2 questions. As a result of all the changes they're proposing to the HHCAHPS survey, they are having to remove 3 outcome measures calculated from those questions, from some of those questions, from the home health value-based purchasing model. This leaves the home health value-based purchasing model with a deficit in outcome measures to be utilized in the total performance score calculation. In addition to them taking away these CAHPS measures, they are proposing additional OASIS-based measures to be added to the value-based purchasing model in 2026. The 3 items they are adding is M18, 10, 20, and 30 from the functional calculations or session of the OASIS. These functional items are quite shocking because of the fact that when the GG items were put in place to be utilized with the discharge function score this year, the anticipation was that 1800s would no longer have any impact on the value-based purchasing model. Their comment is that these 3 1800 items will complement the discharge function score. As a result of adding these items, there will be a significant higher number of OASIS items versus other items in the value-based purchasing program. So they are proposing changes to the measure weighting. OASIS would be 40% of the total performance score, claims-based measures 40%, and HHCAHPS would be only 20% of the total performance score. So this is a huge change, not just for HHCAHPS, but also for the value-based purchasing program. There are also some other changes they are proposing for the home health quality reporting program that we will address with you in a future Monday Minute. Thank you so much for participating today. Please don't hesitate to reach out to HPS if you need assistance of any kind with your home health agency or with understanding this home health proposed rule. Please make sure that you are your own advocate by participating in the comment period of this home health proposed rule, which ends on August 29th. Have a fabulous week.